Hi, this is Dr. Bera, your representative in Congress. Thank you for taking some time out this evening to join my telephone town hall on the topic that is on all of our minds. Obviously, we're now going into the third month of this global pandemic and COVID-19, and I know we can be proud of ourselves in the Sacramento area for really following the stay-at-home orders and avoiding the worst of this pandemic. But as all of us know, this is a virus that's affecting all of us, either directly by contracting the disease or one of our loved ones, and indirectly by really just impacting the economy in a way that affects all of us. And tonight we're going to try to answer your questions, give you pertinent advice. I'm going to be joined by Dr. Peter Beilenson of Sacramento County, who's done a wonderful job helping guide us as our health director, and Heather Luzzi from the Small Business Administration. And we're going to want to hear from as many of you as possible. So if you do have a question and you'd like to ask that question, go ahead and press 0, and you'll be connected to one of my staff members, and you'll be put in the queue. We've got about 45 minutes to an hour tonight, so we'll try to get through as many questions as we can. And I know we've only got Dr. Beilenson for a short period of time. So, again, if you have a question at any time, please press 0, and we'll put you in the queue, and we'll try to get through as many questions as we can. In addition, one of the best ways my office can communicate information to you is through our email list. That's how we can let you know the things that are happening at the federal level, if there's health concerns and advice coming out of the Centers for Disease Control and other areas. If you're not on our email list and getting those regular updates, please press 1 right now, and we'll add you to the email list. And in addition, if this is a time where we've all got to look out for each one of us. If you have a pen and paper ready, if you ever need to reach out to my staff, we're here to help you, whether that's Social Security, Medicare benefits, stimulus checks, things like that. Our phone number is 916-635-0505, and we're here to help you. Again, these are unprecedented times, and one of the most important things I can do is to try to get the information that I hear both as a member of Congress, but also in my capacity as a doctor and someone who used to be chief medical officer for Sacramento County. If we stick together and we're in this together, we will get out of this together. And it is going to affect all of us, but again, we can be proud of how we responded to the first phase. Dr. Beilenson may touch on this, but of the 50 most populous metropolis areas in the United States, Sacramento had the lowest case rate. So that's a testimony to all of us, every resident here, kind of heeding the public health advice of Dr. Beilenson, Dr. Fauci, and others of staying at home, trying to flatten that curve, giving our hospitals the ability to create capacity and take care of folks. And, that's incredibly important. And it'll also be very important for us to follow the advice of Dr. Beilenson, Governor Newsom, Dr. Fauci, and others as we start to think about what does relaxing some of these stay-at-home rules look like, and how do we make sure we're ready if we know the virus will still be out there, and instead of shutting the whole thing down, that we can actually slow things down. So with that, again, if you have a question, please press 0. And we will try to get through as many questions as we can. And let me turn this over to Dr. Beilenson, because I know we only have him for a short period of time. Peter, if you're on.
Yes. Thanks, sir. Thank you very much, and thanks for having me on. Just want to give you guys a sort of a compendium of statistics to let us know where we are in Sacramento County and compare it to the rest of the country. We have 1,153 cases now, 49 deaths, which is a remarkably low number considering how large we are. We're 1.5 million people. And again, as the Congressman was mentioning, we rank number 1 in the entire United States of America among urban areas greater than 1 million people in terms of how low our numbers are. And lest that be thought that New York City tests more and therefore they have a higher rate. In fact, our hospitalization numbers and our ICU numbers and our death rates are all in the bottom 5 of the United States as well. So in other words, we have the lowest death rates, the lowest hospitalization rates, and the lowest ICU rates in the United States of America. So as the Congressman was pointing out, Sacramentans have done a remarkably good job of staying at home and socially distancing. It's made a big difference. We've had 4.5 or 5 weeks now of consistent declines in hospitalizations and ICU visits. It might be of interest to you guys to know that as of today, in the entire county of Sacramento, and all the hospitals in Sacramento, there are only 43 patients that have COVID that are in any hospital, in all the hospitals put together in the county. So again, a remarkable job. That being said, the governor came out today with guidance on criteria that counties had to meet in order to open things up a bit more. And although we met every single criteria, we missed on one, and that is the number of deaths. You are not allowed to have more than one death in the last 2 weeks in any given county in order for you to go further than the governor is wanting to go. So that's going to be very hard to meet, particularly because we already are the lowest rate of any California metro area. And it's going to be hard to go 2 weeks without a death, although obviously we would greatly wish that to happen. So what's going to happen tomorrow is the governor is opening up what's called phase 2 and sort of a soft launch where they allow retailers to sell on the curbside, including florists, bookstores, other stores, including malls, where you have to be outside the mall, but they can sell on the curbside outside of malls. But for the other counties that have qualified by meeting these criteria, and they are virtually all the 25 smallest counties in California, they will be able to go a bit further. So let me stop there, Congressman, and be happy to take questions if people have them or if they want further data.
Great. Thanks, Peter, for that update. Let's take some questions that I think you could be good to answer. We've got a question from Erin, who says she has symptoms and can she get tested? Erin, are you on the line?
Yeah, hi, Congressman. First of all, I want to just thank you and Doctor for doing this. It's really helpful. I was on your very first call that you did, found it was helpful, and then shortly thereafter in mid-March, I came down with COVID-like symptoms, and I've been in bed for just coming out of it now 7 weeks later, and I wanted to just ask about the test qualifications and if they've changed at all from the beginning where, the first week we were told we just didn't have, the doctor said you qualify, we just don't have the swabs, and then the second week said, after 2 weeks it's usually over and you might not be negative, and then after it went on, it was, questions of, have you been out of the country? Are you over 65? No, I haven't been out of the country. No, I'm not 65. So there's a litany that I think CDC guidance, and I'm wondering if that's changed because it struck me by about week 3 in my experience that it was irrelevant if there's community spread, whether or not we've traveled or not, because there's community spread. So I just wanted to know if that's changed. And I live with my mother who's 86, a diabetic and high risk, and my rational assumption in the beginning was, I need to get tested to protect her. And I'm just wondering how things have changed since it seems like there's been a lot of opening up. I've had a lot of friends telling me things have changed, but I don't know, and there's a lot of questions out there. I know a lot of my friends have been, Googling and emailing. So if you could help with that, I think it would be a great.
Peter, do you want to give the latest testing
So,
availability?
Yeah, testing availability has dramatically increased. We used to do 20 per day about 2.5 months ago. We're up to now well over 1,500 today, probably close to 2,000 tests. Originally, we were only testing people who had symptoms. There are now testing sites available for those who are asymptomatic or those who do not have symptoms. These are all tests for the presence of the virus. So right now, it wouldn't make sense for you to get tested for the virus, but at the time, it certainly would have, and potentially to have isolated your mom as well. The tests for asymptomatic patients are at the drive-through clinic at Cal Expo now. And also, we're going to be doing several community-based walk-up clinics that I've talked to Congressman Bera about at La Familia, Roberts Center in El Paso Heights, and St. Paul's in Oak Park, with several more still to come. All of them will be open to people who don't have symptoms.
Great. Peter, folks will still need to make an appointment to get tested?
Correct. Okay. Correct. You can either go online or make a telephone call. These community-based sites, which I just mentioned at the end there, will be up and running by the end of next week and then going for the next 2 to 3 weeks. And I think maybe, Congressman, you want to point out the antibody test as well?
Yeah, absolutely. We can test that. And for those that don't have the numbers, again, we will send that information out on our email list. And if you're not on our email list, go ahead and press 1 so we can get that information to you. Peter, there's a second test, which is a serologic test. It's a test of antibodies, which would suggest if you had coronavirus, COVID-19, recovered, maybe never showed any symptoms. And Peter, how's the county, administering the serology test?
Yeah, so serology test is actually a blood draw. This is for antibodies, which are a substance that your body produces to fight off infection. And when you fought off an infection, you have presence of antibodies. And they're specific to the type of virus. The tests for antibodies have been the wild, wild west, I think the governor has called it, of tests in terms of finger pricks and all sorts of different kinds of testing have been proposed. Many of them are not efficacious at all. The best ones seem to be the serology that are blood draws, and they're about 70 to 80% true positives. In other words, if you, ma'am, who had the case earlier this year, or potentially had COVID, if you got tested and showed up positive, you'd be one of the 70 to 80% of people that test positive for the antibody that have had the disease. Whether that confers immunity, if you extrapolate from other viral illnesses, you would think it would. We think it probably does, but we're not sure yet. So they're just starting, the antibody tests that are seriously validated are just starting to come on the market right now.
Great. Let's go ahead and take another question. We've got a question from Billy, who's a retired physician. Billy, are you on?
Yes, I am. Yes, I'm living in an assisted living residence here in Carmichael, and of course the staff is all wearing masks and everything, but the residents aren't. And so I asked the director about it, and he said, "Oh no, those are the guidelines that he had been given, that the residents didn't have to." Well, as a result, of course, we've got everybody running around without masks, and we're kind of a high-risk situation. And I just thought, since I was kind of do this anyway, I would ask what your thoughts were, or if you knew what any official recommendation would be for that situation.
Yes, so very important. Sorry, Congressman. So assisted living sites as well as skilled nursing facilities or long-term care nursing homes are particularly vulnerable populations for a variety of reasons that are probably obvious. My mom's in assisted living, so I can tell you that I have that very close to my heart. They have all gotten masks, and they now actually have a couple cases in their, actually they had a decent number of cases in their site. And for to reassure people, virtually all of them did not end up hospitalized, whether the staff or the residents, and they've almost all gone to negative. So you can actually manage an outbreak well in a place, but I think it's very important to wear masks. It protects you and it protects the staff.
Thanks for that question, Billy. We've got a question from Stan in Citrus Heights. Stan, are you on?
Yes. I know a restaurateur who's been closed, and I was talking to him yesterday, and I told him about a device. He says, gee, if I only let 20% of the people in here, I'm a one restaurant owner, how can I survive? Keep one cook and one waiter? I've got 20 people that I've hired before. So I mentioned to him about a device. iHealth makes a device. It's not a perfect meter, so I wanted to talk to some doctors about it. iHealth makes a no-touch thermometer. In 1 second, you run it across the forehead. You don't touch anybody with it, and it gives you a temperature reading. And I told him about it. He says, gee, if nothing else, Stan, I can at least know that the person I'm letting in my restaurant is sick or not sick. It doesn't tell me he's got the virus or not, but it tells me whether someone is sick or not. And it costs, I looked it up. You can get it at Walmart for $40. It's a new device. Is something like that of any value at all, where there's no contact? Someone stands at the door. You can even do it at a stadium of 80,000 people. Everybody has one that collects the ticket.
Yeah.
You scan the guy's forehead. Don't touch anybody. If his temperature says 101 degrees, hey, fella, you go to the doctor. You can't come in here.
Yeah.
At least it tells you whether a person is sick or not.
I think
I'm trying to figure.
Great question, because I think there is some utility to that. And as you're seeing guidelines come out for folks that are, as we start to reopen some of our hospitals to do elective surgery, there will be guidance on temperature checking, and as folks potentially come into restaurants. Peter, do you want to think through? I know you're in the process of thinking about what the guidelines for safely opening restaurants might be, as well as other facilities.
Yeah. So thank you, Congressman. So we've been coming up with our own roadmap of how to open up, and actually one of the very first things we were going to reopen were restaurants. That may be on hold now with the governor's new criteria, but it includes things like temperature checks, which, as you said, are not a guarantee, because someone can be asymptomatic or not have symptoms and still be shedding the virus or be contagious, but it certainly would pick up the majority of people who have fevers. Secondly, there'll be reduced numbers of capacity in the restaurant. So instead of like 10 four tops, you may have 5 four tops. And then the servers would probably wear masks, and you probably wash their hands extensively, but more importantly than wearing gloves. And then we'll probably use disposable menus. But one potential thing for that the Congressman and I were actually talking about last week, for restaurateurs who have openings who open out onto alleys or onto streets, is more outdoor serving areas as well, which could be shared between different restaurants that still increase the amount of capacity that people can use. So just to show you that there are things that can be done to alter the environment that makes sense and it can generate economic growth, that, if we're allowed to do it, we certainly will.
Well, thanks for that, Peter. And we really are trying to think through what are creative ways that we can, one of the great things is the farm to fork aspect in restaurants or small businesses that have been hit really hard. What are ways that we can get them back to work in a safe way, not put their workers at risk, and certainly not put the patrons at risk? And one of those ideas is, can you put more tables outside with physical distancing and appropriate precautions? We've got a lot of questions about schools and what's going to happen with the schools. We've got a question from Deborah in Elk Grove. Deborah, are you on?
Hello, Congressman?
Yeah, hi, Deborah.
Hi, how are you today?
I'm good.
Okay, I'm calling because I'm concerned about the reopening of the schools. You have like 20, 30 kids in a classroom. How will social distancing be done in an environment like the schools?
That's a great question. Yeah, and I know a lot of parents who have kids at home who may be doing some distance learning, et cetera, and it's not one that I totally have an answer for, but I do know, talking to the superintendents, they're thinking about how you can do that with physical distancing in a safe way. And Peter, you probably have more of those conversations than I do.
Yeah. So I've been talking to the head of SCOE, which is the Sacramento County Office of Education, which oversees all 13 public schools districts. And the most likely, and so the state also has a task force, as does every jurisdiction basically, in how to start schools up safely again. One of the main things is going to be cohorting. So, for example, if there are 30 kids in a class, have it down to 15, and the 15 come on Monday, Wednesdays, and the other 15 come on Tuesdays and Thursdays. So you can have the social distancing that's necessary. You can have cafeterias staggered, et cetera. You can have PE periods staggered. So there are a whole bunch of ways that we're looking at doing this. It will be phased in over time. I'm guessing, if I had to make a guess, that school will maybe, well, I probably should not hazard a guess. Whether or not it starts back in a similar way that I'm talking about now in September is questionable. But I think certainly by the second semester we'll be back in relatively normal times.
Great. We've got a question from Diana in Sacramento. Diana, are you on? Diana?
Yes.
Okay. Yes, Diana, you're on.
Yes. Hello? Can you hear me?
We can hear you.
Yes. So we have my son has two small children. One is 4 and the other one is 8. And they live with their mother and she stays with her parents. And my son is with me. And we haven't seen the children like 2.5 months. We're trying to do the best we can with all that's going on. But we're really, really missing them. We see them 3 times a week on Skype, talk with them, but that is all. And they, my daughter-in-law, her grandfather, the children's great-grandfather is going to be turning 102 next month, and not in the best condition. He lives, we all live Sacramento, but he lives in Davis. But my daughter-in-law's father he has a lot of contact with him, but they don't want the children close to us in case they transport something back to them and it gets to the grandfather. But how long do we have to wait before it's safe for, my son to see his children and my grandchildren here?
Diana, thanks for that question. I think that's one of the biggest heartbreaks of the whole pandemic is, the fact that you just want to hug your grandkids and see your grandkids, and you can see them on Skype. It's not the same thing, and to keep their great grandfather safe. Everyone's doing the right thing to protect life, but there's no replacement for that human connection. Peter. I talked to some of our neighbors who are going through the same thing, and it's like, look, I can see my grandkids from a distance, but it's not the same thing. And do you have any advice or thoughts?
Yeah. So while we're in the stay-at-home, it's actually potentially relatively easy to do. If you stay home for 2 weeks and really isolate yourself and your son, then they should be fine to go see your grandchildren or his children. Certainly in a socially distanced way, but I think actually in a much closer way as well. Congressman, what do you think?
Yeah, I think that's true because we know the life cycle of the virus. If they're sick and symptomatic, you should see something in that 2-week period.
Yeah.
And if you want to truly be safe, if you have access to testing, potentially getting tested and so forth. But I think that those are the types of things that we'll work through. But that is the human toll and the human aspect of this virus as well. We've got a question from Dave. Dave, are you on? We may have lost Dave. We've got okay.
Thank you for having me on. I live here in Folsom, and about 2 weeks ago, both my wife were wearing masks, but the last week or so, I noticed a difference. About 85% of people in Folsom are wearing masks. But what worries me, I don't know if it worries me, but what I see is our leaders, the president and other people in power do not wear masks, so that if they should set an example.
I couldn't agree with you more. I wear a mask when I'm out in public, and if my wife and I are going for a walk, we'll make sure we physical distance. But if we're going into a store or any place where we may see people or be in a place where there are a lot of folks, we should be wearing face coverings. And again, my advice as a doctor to the President of the United States would be to to wear a face covering. I know he went and visited a mask factory yesterday and didn't actually have a face covering on. So I think it's a missed opportunity. What I can say is we should be proud of what we've done here in Sacramento County, really following the guidelines that, have been issued from Dr. Fauci, Dr. Beilenson, the governor and others. And I think that is part of the reason why we didn't see, as much illness and death as, I think many of us expected. So keep following the guidelines that our local leaders put out. And I know all of us understand the desire as we move through spring and summer to kind of open up and get outdoors. And I think there's safe ways to do that. Peter, do you want to add anything?
No, I think that's a good note to segue on. So thank you for having me.
Great. Thanks, Peter. Thank you for being on.
Sure.
We also, and be safe, Peter. So we also have a lot of small business questions, and I know, one of our guests is Heather Luzzi, who's our regional small business administrator. She's been doing a wonderful job under really stressful conditions because, we're trying to do everything we can to keep small businesses afloat, to keep people employed and have paychecks. Heather, can I turn it over to you and have you, just kind of give a recap of where we are?
Absolutely. Thank you so much, Congressman. It's a pleasure to be here. And I would just like to say with the most recent amount of funding through the CARES Act with respect to the Paycheck Protection Program, the most recent numbers that we show are over 2.5 million loans approved for $185 billion. And again, that's on round two. Round one, if your callers may recall, the CARES Act had appropriated $349 billion during that, and there was 1.66 million loans made under that one. What's really astounding to us at the Small Business Administration is that the average loan size has dropped substantially. So the average loan size in this tranche of funding is currently $74,304. In the first round of funding, it was in excess of $206,000. So I think that that's very telling about the businesses and the size of businesses that we are currently serving under that program. I also want to give kudos to our banking partners. They have just done a fabulous job in getting the access to capital out to the small businesses that we have the honor to serve in the district. With that said, we don't necessarily have the exact numbers for the loans within the district, but we're hoping to have that any day, so we'll be able to announce that soon. But we have made a huge, huge difference. Again, we've got a long way to go, but I'm very, very proud of the agency and our staff, and again, our banking partners, as well as our resource partners. So those resource partners would be the Small Business Development Centers, the Women's Business Centers, the Veterans Business Outreach Center, and our SCORE mentors and counselors. With that, other parts of the CARES Act also approved through a debt relief component that all SBA current loans would have a debt relief for a 6-month period, and that would be where SBA, through the CARES Act, makes the payments on all of those transactions. So any of the 7A loans, our 504 loans, as well as the microloans. So principal, interest, and fees on those transactions. Something to also keep in mind as we're getting back up and running with our small businesses is that any newly originated loan through September 27th of the year 2020 is eligible for this debt relief component. So again, no fees and SBA would pick up the principal and interest on those transactions for the 6 months from the point of origination. So that's kind of where we stand. Is there any questions pertaining to the Check Protection Program that I can answer?
We do have some questions. We've got a question from Larry in Folsom. Larry, are you on?
I believe I am. Hello?
Yeah, I can hear you, Larry. Seth.
Oh, yeah. Okay, thank you. Thank you so much for this, Congressman Bera. With the health issues and all that stuff, I feel almost bad asking a financial question. But I'm a business owner. My wife and I own 3 salons in Sacramento County and have approximately 47 employees. And since we're in phase 3 of the reentry, and we received the PPP today, but it's likely we will not be able to open at all during the 8-week forgiveness window. And after advice from several CPAs, it looks like it probably won't work for us because of that requirement. So we'll basically probably have to give the money back, and it's on a 2-year short-term loan. So, and I've run the different scenarios because it doesn't cover federal payroll taxes and different things. And it's going to be very difficult to get some people off of unemployment because unemployment rates are actually higher right now than some of their wages because they're like 18 or 19 or 20-year-olds just starting out. So I was wondering if you guys were aware of these issues and if there was any chance there was anything in the works to solve some of them.
You know, I'll start with that. I know we certainly are aware of it in Congress, and you know, either next week I'll be back in Washington, D.C. if we have a bill put together, or the week after, and that's something that, yeah, this pandemic won't be over in that 8-week time period, and we know even in recovery it's going to take longer. So that is one of the things that we're going to try to address in terms of extending that 8 to 10 week period and going a little bit longer, as well as addressing some of the issues that you just raised. You know, we do want to encourage people to go back to work, but we also recognize that, you know, we don't want unemployment to be the incentive for them not to go back to work. Heather, let me turn it over to you and see if you want to add anything to that.
Sure. Congressman, I actually echo your sentiments, but also, Larry, I would point out that in some circumstances you're absolutely correct. The Paycheck Protection Program may not be appropriate for your small business, but I certainly hope that you're being advised about the employee retention credits that are available through the IRS. That may be a much better option for you and your business based on the model. So with the CARES Act, again, there's several different components to this, and it's not a one-size-fits-all. So really, it's great that you're speaking to your accountants, and we're happy to help you here at the SBA navigate those waters. Feel free to give us a call at any point, and we'll point you in the right direction.
And Heather, thank you for talking about the employee retention tax credit. That is also something that we are going to try to expand in this next bill, and that is one of our priorities as well, because we do think for someone like Larry that may be the better option.
Absolutely.
We've got a question from Anastasia in Elk Grove. Anastasia, are you on?
Yes.
Anastasia,
hello.
Yes.
Hi there.
Hi. So I have a quick question. I am a business owner in Elk Grove. I applied for the SBA, the EIDL loan, and my loan was approved. However, so while I was applying, I did take pictures of the screens of, the application to make sure I have a copy. And while I got the approved amount, which is less, like literally 1% of what it's nothing. How can we make corrections on our approved applications?
That's a great question.
If I entered an information that was incorrect, because I'm in the service industry, so we don't have cost of goods, and I put a amount on the cost of goods where it's supposed to be a 0.
Oh, gotcha. So we can actually help you navigate that through your local district office here. The number that you can reach out to for my office is 916-735-1700. Leave us a message. We will call you back and help you to correct that error. And keep in mind, for any of the callers that are on the line, that is our office telephone number. I do have a majority of the staff that are teleworking. So if you don't leave a message, we won't know that you called, but I guarantee you, you will get a phone call back.
Great. We've got a question from Gloria. Gloria, are you on? So, Gloria, are you there? Gloria?
Hi, yes, thank you.
Yeah, hi.
Thank you for taking my question.
Sure,
Wonderful.
hello.
Thank you for taking my question.
Yeah, of course.
This question is maybe a little bit more for Representative Bera, but I'd like to know if you would consider supporting legislation that would provide student loan relief for nurses, doctors, and other medical professionals who've been on the front lines during the pandemic. I understand that there's a Congresswoman Carolyn Maloney in New York has introduced H.R. 6720, which does just that. But I'm afraid that now we're kind of past the initial panic phase of the pandemic, where we were worried about there not being enough protective gear for first responders, and I'm afraid this effort will lose steam. So,
no, I being a former dean of admissions, knowing the amount of dead nurses, doctors, and others carry, I'm in full support of finding ways to lower that burden on them, up to, if they're doing this hazardous work, potentially fully relieving them of some of that burden. And thank you for bringing that up, Gloria. The first responders, the nurses, the doctors, while we weren't hit extremely hard, nobody knew what this was going to look like. And I don't want to sugarcoat things. We don't really know what the future looks like. Is this a virus that will flare up in the wintertime again, like we see the flu every year? We really should thank folks that were putting themselves in harm's way, stepping up. And, Congresswoman Maloney's idea is one idea. There's others that are out there, but I think that is one way that we could take a burden off some of these nurses and doctors. And, again, for any of the first responders or folks that work in the healthcare field, grocers, folks that are going to work on a regular basis and interacting with folks, thank you for, keeping our community afloat and doing the work that you're doing. We really appreciate it as Sacramento and as the United States of America. Let's go on to the next question. We've got a question from Delonda. Delonda, are you on?
Yes, I am. Thank you so much. My name is Delonda Coleman, and I have a law office in Elk Grove. And my question is for the SBA representative. And so my question is, once an SBA authorization number is issued, does that mean that the applicant's application has been approved and you're just waiting for funding from the lender? Or is there another step with SBA?
So actually, Delonda, that's a great question. And I think that there's a lot of misinformation with respect to the way that the Paycheck Protection Program has been deployed. So with the PPP program, the lending institutions have the autonomy to act in delegated authority, which means that they can move forward with the transaction at will once they feel that they've properly documented their file. So once they electronically submit to SBA, they would get a loan number or an authorization number. That's simply documenting the agreement with SBA guaranteeing that loan at 100% against the loss. So it's really up to that lending institution to then deploy or disperse those funds. And the way that the CARES Act is written and the PPP loan is written is that those funds have to be dispersed within 10 days of that lender obtaining that number. So if you're close to that 10-day time frame and haven't heard anything, I would encourage you to reach back out to your lender, or feel free to give my office a call and we can help advocate on your behalf.
Heather, can you repeat the number for your office?
Absolutely. It's 916-735-1700.
Great. And let me, my district office and staff, and we're here to help as well. Our phone number is 916-635-0505. And also, if you're not on our email list, one way to, we push information out is through our emails to folks. And if you're not on our email list, go ahead and press 1, and we'll add you to that email list. Let's go to another question. We've got a question from Nick. Nick, are you on?
Yes, hello?
Yeah, hi, Nick.
Hi, Nick.
Hey, how's it going? Okay, so I actually have 4 questions, so I know that's a lot, but hopefully, we can get some answers to them. My first one is, why are small business resources not available to self-employed? We've applied for the loans and the grants and everything else, and we keep getting denied because they don't consider us an actual business, even though we make up 30% of the workforce. And I have multiple other friends of mine who are also self-employed, all saying the same thing. And the only thing that's been presented to us is unemployment, and the unemployment only constitutes $167 a week, and I'm having to defer rent and stuff like that. That's at $2,000 a month. And I'm being asked to pay that back before December, but yet I'm only getting $167 a week.
And Nick, I think that's a great question. That's something that we tried to fix in this recently passed bill. And Heather, I'm sure that's a question you get pretty frequently.
It is, definitely. Just so you're aware, Nick, with the most recent updates to the Paycheck Protection Program, it actually allows for self-employed and independent contractors. So please, if you haven't applied or if you've been told no previously, try again or call my office, and again, we can put you in contact with a lender that is willing to do those transactions.
And Heather, in this last round, one of the things that we also wanted to do was make it easier for some of the smaller banks, the community banks, as well as credit unions, where a lot of folks in our region have an existing relationship to participate in the PPP program and provide that funding. And are you seeing an uptick of the smaller banks, credit unions, and others helping process things?
Absolutely. So that's a great observation, Congressman. So with the most recent numbers that I gave out earlier, we have been dealing with nearly 5,400 lending institutions across the country. So keeping in mind that prior to all of this COVID-19 CARES Act information, the SBA only had lending partners of about 1,800. So that has substantially increased. Along with that is that the SBA last week had actually paused the portal in which the lending institutions get their funding number or authorization number from SBA. We paused that for the larger lending institutions to allow those smaller lenders to have access to the capital that they get on Main Street. So it worked out wonderfully, and it's really one of those very telling features of the most recent tranche of funding is that a majority of that funding went or came from smaller lending institutions. And the most part of it, lending institutions with less than $50 billion in assets approved, 1,173,000 loans. Anyway, I can go down and down, but $10 billion in less than assets, and they were a huge contributor to the success of the current program. Keeping in mind that there still is money out there through the Paycheck Protection Program. And a lot of our community banks and credit unions are participating. It's just a great way to, walk in the bank and have them know your name. That's a lot of the comments that we're getting back from these smaller lenders.
And as we negotiate the next bill, we're going to continue to prioritize those community banks, because for self-employed individuals or just the mom-and-pop businesses, they may not have a relationship with the real big banks, but they may know their community banker or their credit union, and that really does make things better. We've got let's take another question. We've got a question from Andrew. Andrew, are you still on?
Yes, I am.
Great, Andrew.
Hi, Andrew.
Hi. I have a question for you. I'm a small electrical contractor here in Orangevale. I was looking at the numbers on the CDC website, and I was noticing that the actual number of people that had contracted the disease or virus or whatever you call it, I took that number, and I also took the number of deaths, and I put that into my equation, and then I also went to the Census Bureau and looked at the actual current population of the country. I crunched the numbers myself, and I found out that the actual people that are contracting this disease is very close to 0.5%, which makes me think that it's very similar to the seasonal flu numbers. Now, what constitutes this mass worldwide hysteria?
Great. I think that's a really important question. I'll go ahead and take it, Heather. I'll put my public health and doctor hat on. The one difference is you'll hear people use the term novel coronavirus. What that means is we've never seen this virus before, and it's brand new. So we know there's no immunity to this virus. So, and it's still just spreading, right? You're watching the virus circulate and spread. What we do know where it's different from the flu is this is a much more contagious virus, and it is a much deadlier virus in that sense. So we know we see the flu every year, and we know a lot about influenza, and we know that virus changes on an annual basis, which is why you have to get a new flu shot every year. We probably know less about this virus, the COVID-19 virus, than what we do know about the virus. We're learning new things every day, and like a question that came up earlier was, if I had the virus, I recover, now I have antibodies, can I get infected again? We think those antibodies protect you, so if you've already had the virus and you've recovered, we don't know how long that protection lasts. We don't know, does it last a few weeks? Does it last a few months? We also don't know if the level of antibodies that you have protect, what that means, because, again, we've only been studying this virus for a couple months. That said, the one thing that we do know we can do, because, again, we have to accept the reality that this virus will be with us until we have a vaccine that is safe, that is effective, that we can ramp up production, and we can vaccinate enough people in our community, our country, and actually in the entire world. Because unless we get to 80, 90% of the world vaccinated, this virus potentially could continue to circulate. Take a deep breath, and I think we've done a good job in this first phase. We don't know, is this like other coronaviruses where the summertime comes and you see fewer cold and flu symptoms, but then the winter comes and it pops back up again. The one thing we can all do, though, is as we go into the fall, September and October, that's when flu season starts to pick up, and we do think you may see COVID-19 start to pick up again. I would strongly, strongly, strongly urge everyone to get an influenza vaccine to help protect against getting the flu, because the symptoms of the flu are very similar to the symptoms of COVID-19. And as we try to not have to shut down the entire community and keep people at home, if we know you have a flu shot, it doesn't always prevent you from having the flu, but it does do a pretty effective job keeping people healthy. So the one thing we can all do to help our community and our country is to get our flu shots. Let's get back to some other questions. And I know we've got a ton of questions, and we won't be able to get through all of them. If we don't get to your question, if you stay on the line, you can leave a message, and please do leave your name, your number, your contact information, if it's an email address. And it may take a few days because we always have lots of questions, but my staff will work through that and try to get back in touch with you and try to help you with what you can. If for some reason you don't get that ability to leave a message, our district office number is 916-635-0505. We can take a couple more questions. We've got a question from Margaret. Margaret, you're on.
Yes, I am a retired senior citizen. I do receive Social Security, and I understand that I am eligible for the stimulus check because of my low income. I have not received a check. I am wondering if those are still going out and when I might expect that.
Thank you for that question, Margaret. Yes, you are eligible for a stimulus check. If you haven't received anything directly into your bank account, what you can do is if you go to my website, which is Bera, BERA, house.gov, we have information on that website of how you can go to the IRS, the Internal Revenue Service, the IRS portal, put your information on, make sure they've got your accurate address and bank information, because they are trying to get these checks to folks as quickly as possible. So if you do have a bank account, they can directly deposit it that way. But if you haven't received it, go to that IRS portal. And if you're having trouble finding the portal or our website, again, give my office a call, which is 916-635-0505. But yes, for folks that are on Social Security that are below the income thresholds, you are eligible for that stimulus check, and you should be receiving it. Let's take maybe one or two more questions. We're coming up on about an hour on the town hall. We've got a question for Bruce. Bruce, are you on?
Yes, I am. I'm a contractor working out of Folsom. My question is about the SBA loan. I was thankful that I did get a loan. It happened to be half as much as I asked for, which was only $15,825. So I could burn hands with two in the bush. My question is, it only covered my exact payroll, none of the extra things that was referred to in the SBA loan application. Now, I filled out the application, then the B of A application. B of A said you've been assigned an SBA loan, and so someday on Friday and then on Sunday I received the money. The question is, I have not received a copy of what the SBA loan identification number is, nor any information so I can fill everything out like I'm supposed to and, hand in my payroll records to show I'm complying. So I don't know how to do that.
Sure.
Go ahead, Heather.
Sure. Thanks, Bruce. With the Paycheck Protection Program, the way that the program is supposed to work from our lending partners is that they will look back at historical payroll records and calculate 8 weeks out, and then also put additional funds in there for mortgage or rent or utility payments, etc. If that didn't happen, we can certainly, talk to the lender and how we can, get that corrected prior to the funding being depleted. I would highly suggest, Bruce, you call my office and we can go through this together, and I can give you your SBA loan number. So again, my office number is 916-735-1700. And again, if we don't pick up, please leave your name and telephone number, and I promise we'll call you back.
And we're coming up on about 1 hour. Let me just repeat the SBA number because I know we've got a lot of small business questions. 916-735-1700. Our district office number, my staff's number is 916-635-0505. And if you're not on our email list, the easiest way for us to push information out is through our email list, and press 1 and you can provide your information and we'll add you to that list. You could also always go to our website, which is www.bera.house.gov, and sign up that way. We also have a COVID-19 resource guide that provides a lot of information to frequently asked questions, but we're here to help. If we didn't get to your question, and unfortunately there's a lot of questions that are out there, then please do stay on the line. You'll get a chance to leave your name, your contact information, a phone number. My staff will work through it over the next few days to get back to you. Let's wrap up with this last question. We've got a question from Steve in Elk Grove. Steve, are you on?
Yes.
Yeah.
Yes, I'm here.
Thanks.
Hello, Congressman Bera. Thank you for taking my call.
Yeah, go ahead. Ask your question.
Okay, my question is, I've noticed that we're going to begin to start letting the economy and the businesses open up again slowly, but I want to know what kind of safeguards they're going to take, because I mean I've seen, like with companies like Amazon, where they take a lot of safeguards to protect their employees, and yet they still have infections, and they've had people that have become sick in their employment areas, and also like with the meat packing companies like Tyson and Walmart. These agencies, these large agencies, again, they have a lot of safeguards they put in place to protect their employees, but yet the people are still getting sick and they're still having illnesses. So I wonder what kind of safeguards we're going to enact when we start opening up the economy solely for these other businesses, including the small businesses, to protect everybody.
Yeah, Steve, I think that's a great question. That's a way, we really did, as a community and a region, come together to help us get through this first phase of COVID-19, of this pandemic. And while we can be proud of what we did as a community to try to make sure we didn't suffer the way our brothers and sisters in New York and elsewhere suffered, we know that virus is still out there. So I think Dr. Beilenson, if you were still here, would share how we're thinking about this. This will be a slow, incremental opening, and we will continue to increase the number of tests. I'm glad that the county, is now close to 2,000 tests a day, and is making it available for people who don't have symptoms to be able to go get tested. I think that's incredibly important. The second piece is, as we do open up, we know the physical distancing that we've done, staying 6 feet apart, has actually worked. That for those folks that can safely work from home and telecommute and do their jobs from home, the advice is going to be that to the extent that they can, that they continue to work from home. For those that have to go to work, if they work in a small business, et cetera, in a phased way, you'll continue to see measures to have folks physically distance. So, you see it in the grocery stores, you see the tape on the ground at checkout lines. If offices are opening up, you'll see that They will probably have to reconfigure so you don't have cubicles next to one another, but you actually have some separation in space. You will probably also see guidelines that clearly if you have any symptoms, fevers, coughs, headache, body aches, you should stay home or you should get tested and see if you have it. But the initial recommendation is if you have any of those symptoms, you should stay home and let someone know. And then if you test positive, we are starting to build up a big public health workforce that can then come to your house, test you, and see if you've had contacts with other people and certainly test the folks around. So we don't have to close the entire community, but we can hopefully close down clusters. I think you will also continue to see recommendations for the foreseeable future that even if you don't have symptoms, as you go out and you're close to other people, you should wear a face covering. A cloth face covering is effective in that case where we're worried about folks who are not showing symptoms to make sure they're not actually spreading the virus to others, because we know the vast majority of folks who get the virus will likely not have symptoms or have very mild symptoms. And that's part of what happened in this initial phase, that the virus was spreading and no one knew quite how large it spread. The other population that we know we have to take special care of and provide additional resources, protective equipment, and support are nursing homes that have been hit extremely hard by this virus. That's where up to 40% of the deaths have happened in nursing homes, and you've seen these clusters and spread there. We're going to have to take special care of that vulnerable population. We also know that folks that are seniors that have, that are over 60, over 65, over 70, this virus has hit them particularly hard. We will have to take extra precautions with our senior population. In addition, if you have a chronic medical condition like diabetes, hypertension, and it's not well controlled, we're going to want to take some special precautions with folks that have chronic medical conditions. That said, we are still learning every day something new about this virus. And we got through this first phase by coming together as a community, by looking after one another, and I think we saw in most cases the best of who we are as the Sacramento community. We also know that a lot of people are struggling to just put food on the table, to pay their rent, to pay their mortgage, and have to get back to work, and they're afraid of losing their job, losing their business, and they'd much rather get a paycheck than an unemployment check. And our hope is, as we start to slowly open up in a safe way, that we continue to follow the guidelines that will be put out on a regular basis, that we will continue to monitor the disease, the number of new cases, the number of hospital admissions, the number of deaths, and stay vigilant. And there may be times where we have to slow down a little bit and pull back and open up. But if we stay in this together, not just as a city, but as a state, as a country, and I hope we work together as a world, because this is a global virus. And until we stamp this virus out together, we will continue to be working at this. I'm an optimist. I think there's a silver lining. I think we did get through this first phase, but we will have to be in this together, because we don't know if this is the next 6 months, the next 12 years, or 12 months, the next 24 months. But we do know the virus will be out there until we have a safe and effective vaccine. Heather, do you want to make any closing statements?
Thank you so much, Congressman. I think, first and foremost, the health and safety of our constituents are really paramount. And with respect to serving the small businesses within the district, it's truly our honor. We have a long way to go, as I stated, but I really feel that we've come very, very far. I would just tell you, if you are interested in interested in employment opportunities with SBA, we are hiring. please let us know. Or you can also find information at usajobs.gov for open positions with SBA. And again, Congressman, thank you so much for the opportunity. I sincerely appreciate it.
You're welcome. Thank you, Heather. And that is a great reminder to me. We are going to be hiring up a lot of public health work staff. We're creating almost a Peace Corps type program for public health folks. So if you have young kids, young adults at home, recent college graduates, et cetera, do sign up on our email list, and we will continue to push that information out. I also think, as we need to put people back to work, because all of us want to get a paycheck instead of an unemployment check, we will create a big infrastructure program, create those jobs, really try to put people to work doing things that we know will make our country stronger, our community stronger, and be good for us. My staff would get mad at me if I didn't also mention that you should have received your census information in the mail. It's extremely important to fill out that information because it lets us know who's here in our community. A lot of federal funding comes through the census numbers, and it's done on a formula basis. And especially as we continue with this global pandemic, having accurate numbers of how many people live here, you can fill that out online. You should have received information in the mail as well, and you can fill that out. But filling that census information out will be extremely important. Let's be safe together. Let's be kind to one another and look after one another. And God bless all of you, and we will get through this, and we will come out stronger, and we will come out more resilient. Be well and have a wonderful night. God bless you.
Thank you.